Hello and welcome to today's webinar. My name is Abbey Pick and I am one of the assessment consultants here at Pearson Clinical Assessments. So today's webinar will be an introduction to Cogmed, which is a working memory training programme that can be used by all ages, so from 4 years and above. So here's what I'll be covering today. So I'll be going over what working memory is, what Cogmed is and the platform itself, and how to set up a new user. Its updates as the newest version of Cogmed was released at the end of 2020, the claims and evidence, and also some supporting research. So what is working memory? Working memory is a cognitive ability that enables short-term retention and processing of information to perform a task, and it's closely related to your ability to control attention. So we can also think of working memory as a temporary storage system. So you use your working memory to keep information in your mind for a short period of time. And an example could be when someone gives us their phone number and we need to use our working memory to keep this number in our mind for a short period of time, to then either write it down or to pop it in our phones. It is used to process all stimulus that we encounter, delegates the different parts of our brain to take action. It allows us to block out unnecessary information, which is known as inhibition, and it keeps us updated on what's happening around us. So working memory is key to the brain's processing capacity, and it is vital for concentration, for reasoning, learning, comprehension, and also resisting distractions. So working memory is related to and can help with attention. It can help with concentration, hyperactivity, impulsivity, organisation and academic success. And there's a lot of research on the Cogmed website that is related to each of these areas, but I'll cover a lot of these areas in a bit more detail throughout today's webinar. So what is Cogmed? Cogmed is a working memory training programme. It is an evidence-based programme with lots of supporting scientific research that can help anyone, so children and adults. Cogmed is accessed on any web-enabled device, so this can be your laptop, your computer, your iPads, or even your phones. Phones aren't recommended just based on the smaller screen size, but it's definitely possible to use. And on Cogmed, you have coaches and you have trainees or users. So what's great about Cogmed is that the coaches don't have to be with the users whilst they're completing the activities. So this can be done completely on their own at home, for example. If using schools as an example, the teachers could be the coaches and the students are the users. So they could complete the exercises in a classroom as a group, or they could do this individually, or they could be set the activities to do at home in their own time. So it's very flexible. It's also great if you are a coach for someone who's in a different country or who may speak a different language to you. So you are still able to coach them in a different country or who speak a different language. So as a coach, all of your users will have their own username and password, and they'll have their own individual set of exercises. So the training protocol is individualized by an algorithm that presents the tasks in a rotating schedule, and it adapts to the capacity level of the user in real time. So if Cogmed was to be administered in a group setting, each user would have a different set of activities and different starting points, and with different exercises within the activities. So the order of the pattern of exercises, for example, will be different to the person that they're sitting next to. So there's never going to be any chance of copying or anything like that. And by constantly challenging working memory as its limits for the individual, neuroplastic changes can occur. And it's a combination of neuroscience, gaming, and psychology. So as briefly mentioned earlier, Cogmed has gone through many changes and developments over the years. So it started in 1999, and in November 2020, the newest Cogmed was released and is now used in over 20 countries with more than 200,000 users. So Cogmed has had a complete redesign and a complete re-imaging. So it has a clean and modern design now that emphasises distraction-free and concentrated training. So it has added training flexibility, which I'll show you in a couple of slides. but you have 2 individual choices for difficulty and for design. So it gives you this added flexibility when setting up a user. The platform has a reward-based incentive system, which is great for motivation and compliance. It's a gaming mechanism that integrates rewards during training. So you can earn gold and gems and things like that to build their own city. So it's a little bit like The Sims or like Minecraft. And it has a new and improved coaching system, which is a lot clearer and a lot simpler to use and navigate, with even more information provided. Again, I'll cover this in a bit more detail next, and I'll show you what that looks like. So it's available in 10 different languages, which is great. For example, if you as a coach had a user in a different part of the world, or who's more confident in speaking a different language to you, so you can still coach them and set that up. You just set it up in their preferred language. And there is now a find provider global map where you're able to see on a map where there are other Cogmed providers. And this can be found on the Cogmed website at cogmed.com. So as a clinical provider, you will get access to an online expert tool, which is used for supervising and coaching. So you can create new users, review the number of training sessions that the user has completed so far. You're able to see about the time of the training that they've had. You're able to access the changes in the training index, as well as viewing patterns of performance on the different exercises. You can also see if they've taken any breaks or any gaps in the training, which you might want to then follow up on or look at in a bit more detail if it's a possible area of concern. Or you can see if their performance has dramatically dropped, and then you can follow up on that and provide support and guidance. So all of this information is available to you that you can then use to coach and monitor your users. And the role of a coach is to motivate your user by providing support, guidance, planning, knowledge and feedback. And as a coach, you may also encourage the users to notice and practice their new skills, which further enhances the effects. And as well as being monitored and analysed by a coach, the training can be tracked online and can be viewed by the user too. So as mentioned before, there are 2 different versions of Cogmed based on the programme and the theme. So there is a standard or a light programme. The standard programme includes all different types of training, and the light programme excludes exercises that involves numbers, letters and advanced sequencing. So most people are going to go for the standard version, but the light version is potentially used for younger children, so between 4 and 7 years old, or perhaps someone that has suffered from a stroke or a brain injury. So the theme can either be create or focus. So create is the reward-based incentive one where you earn the gold and the gems to build your city. And the focus theme is just 100% focus on the training with no reward system. Both the create version and the focus version have exactly the same exercises. So the only difference is the reward-based incentive with the create version, which is the one like the game. So once the training has been completed, it allows up until 2 hours after to be able to play for the create theme and create their city using their gold and their gems. The added flexibility allows, for example, an adult recovering from a stroke to choose a lighter programme but without the child-centred theme. So the next few slides is just how to set up a user and to show just how simple this is to do. So as you can see, you just enter the gender, the date of birth, the language and the time zone, and then you move on to the training parameters. So this is where you choose the programme, which is either your standard or your light. If you hover over the little question mark, this is where it will provide you with a bit more detail or information on each of the options if you forgot which ones meant which. And then you select your theme. So this is either create or focus. And again, if you was to forget the information, it's always there to refer back to. So after you've selected your programme and your theme, you then need to select your block length. So a block length is a day's training. So in one day, how long will the session be? And this will affect the number of exercises given in that block. So, I mean, you can't really see here because of the information blocking it off, but you've got the option of 25 minutes, 35 minutes and 50 minutes. So obviously, if you wanted to choose a 50-minute block, there'll be more exercises to complete compared to the 25-minute block. However, these aren't timed in the sense that it will log them out after 25 minutes, for example. It's just a rough estimate of how long it should take. And after you've completed the block length, you'll then come to the frequency. This is how many blocks a week. So you have the option of 3, 4 or 5 blocks a week for how many you wanted to choose. So once you've entered all of that, you'll be given an estimated end date. So this slide is just to show the different estimated end dates based on the different frequency of blocks. So the less frequent, it will take longer, obviously, compared to the more frequent, and then you'll finish that sooner. So who can benefit from Cogmed? One of the great things with Cogmed is that anyone can benefit from it, and it works for both children and adults. But it can help for several reasons, and the typical Cogmed trainee falls into one of 3 main groups. So individuals who struggle with attention and learning, such as those diagnosed with ADHD or a learning disability. Individuals with acquired brain injuries, reducing their working memory capacity. Or individuals with cognitive impacts due to treatments or effects of other diseases. And regardless of the reason that you're using Cogmed, it's only going to do good and lead to positive outcomes and improvements. So as mentioned before, it's for children, adolescents and adults. So the benefits can be seen in school regarding focus and attention, in everyday life, for example, walking into a room and forgetting something. So it will be improving those connections and pathways in the brain and strengthening them. Or it could be at work with working memory and attention. And there have been fMRI studies that have shown that new pathways and stronger pathways have been created post-Cogmed compared to pre-Cogmed. So just a little bit on the claims and evidence. So it has proven effect on working memory and attention. So Cogmed is the only digital therapeutics that has been shown to improve attention in everyday life, and the improvements are equivalent of 2 years of normal cognitive development of working memory in children. So our long-lasting clinical effects. So many clinical diagnoses are associated with cognitive impairments affecting working memory and attention. It's been shown that Cogmed working memory training can significantly reduce these cognitive impairments for individuals. And this includes children and adults with ADHD, children who have received cancer treatment, children born prematurely, and also adults who have suffered from strokes. It improves academic success. So working memory is key for academic performance, including maths. And there is some research on the Cogmed website which shows that after 1 year of Cogmed working memory training, typically developing children improved equivalently of 1 year improvement in secondary school in comparison to a control group. Extensive collaboration with the research community. So the Cogmed method is a result of many years of successful collaboration with the research community. And it's also different from other brain games. And this is because it is evidence-based, backed up with scientific research. With the training method, you have the coach who is there to keep you motivated, and you have the reward system for this as well. And there is ongoing monitoring to track your performance. So it's almost like going to the gym for your brain, but with a personal trainer. And this also shows sustainable change. And finally, supporting research. So as briefly touched on the Cogmed website, there are over 120 peer-reviewed studies and supporting research that you can access, which covers a variety of areas such as academic success, working memory capacity and attention, ADHD studies, working memory and attention in children treated for cancer, and also working memory and attention in stroke patients. So you are able to use the demo feature on the Cogmed website to try this out for yourself, where you select the theme and the programme, and then you can have a go at some of the activities. So this is an example of what it looks like when you use the trial demo. So on this image on screen, the standard programme and the create theme was selected. So this is known as the Cogmed Islands, and it asks you to unpack the crates to get resources to build with. So each exercise is a crate, and when the Cogmed exercises that has been assigned for that day is completed, you'll then earn the money and the gems that you can use to expand your Cogmed world, which can be seen here. So this is the demo mode, and you can see all of the activities are shown, but this wouldn't be the case when using Cogmed for real. So instead, you'll have either 3 or 5 games or activities to do, and these will change each day. So there are a variety of exercises in Cogmed that entail different visual, spatial and verbal tasks that challenge the working memory capacity during this training period. And again, this demo feature can be found on the Cogmed website. Thank you for listening. If you have any questions, please feel free to get in touch with us at pearsonclinical.co.uk. Thank you.